think people right now are starting to hear, we thought it might be possible, people are starting to hear examples of reinfection. And so that would be scary for someone who has had COVID to think, am I going to have to go through this again? And it could be scary for people around them thinking, oh, we thought this person was cured and now they might be sick again. So just to reiterate the point that we all have to continue to take precautions, whether you're a recovered patient or someone, all of us at all times have to live this new normal. But what could you say on reinfection and those question marks around that?
Yes, so I will answer the question on reinfection. I just want to mention briefly on the question of the recovered, the patients who've gone through COVID, because last week we had a really important meeting with some patient groups. I reached out to some groups last month of patients who have recovered from COVID but are still dealing with long-term effects. And so it's still early days in terms of our understanding of this virus and the disease that it causes. So I reached out to this group called Long COVID SOS, and they helped me and us to reach out to other patient groups. These groups are just starting to form. And what we heard from them, we listened. I mean, the point was to say, tell us, what you're dealing with and what the challenges are. And what they were asking for was, first of all, recognition, that this is a thing. This is something that many people are going through. The second is rehabilitation, and not just for the physical and the biological impacts of this, but also from mental health and from stigma. And the third is research. How do we look at what needs to be done in this patient population? So we heard them loud and clear, and we have, have a way forward. We have a rehab group and we have a mental health group, but it's something that we need to continue to look at. So we are looking at this and making sure that those that need help will get the help that they need. And we will work with our member states, because it's how we work with countries and how we work with governments to ensure that those services exist. But to specifically answer your reinfection question, so this is also a question we get a lot. So what we understand is when someone is infected with the SARS-CoV-2 virus, this virus that causes COVID-19, is that an individual develops what we call an immune response. Their body develops a response that protects them from reinfection. And we are seeing this through a number of studies that are being conducted all over the world. Whether you've had asymptomatic infection, meaning you haven't had any symptoms at all, but you may have had a positive PCR test, or you've had very severe disease, you will develop an immune response. What is not completely clear right now is how strong that immune response is and for how long it will last. So we have an example that was reported on Monday from Hong Kong of an individual who we believe is the first example of reinfection, that is documented reinfection. So we need to put this into context, because this is the first example of this, and it's been confirmed through sequencing, so we know it's a different, it's a second infection out of 23.5 million cases that have occurred worldwide.
So we think that other reinfections may have occurred. This is the first one where we've seen all the science and we're able to really follow this particular
so it doesn't mean that it's happening, a lot. We know that it's possible, but it is something that we knew could be possible based on our experience with other human coronaviruses. There are 4 human coronaviruses, the common cold, that circulate, and people, get the common cold every few years or so. And we know from the first SARS-CoV virus back in 2013, people have developed an immune response, and that lasts for years. For the MERS coronavirus, which is another coronavirus, they have an antibody response for 10 months up to a year, but then it seems to go away. For this virus, we're learning. So I want to reiterate, this is one example out of 23.5 million cases so far, but we expect that people who are infected do develop an antibody response. They do develop an immune response that lasts for some time. So we're learning, and so, please make sure that no matter what, you practice your physical distancing, you practice your respiratory etiquettes, you follow the local guidance that is being recommended, you wear a mask where you can't do physical distancing, you keep informed. All of those measures still apply, even if you did get infected once. Those measures still apply, because this is just good practice. And I think this is our new normal. As we move forward, we're going to have these measures in place for some time.
So we said it's 1 in 23 million, but we don't think it's only happened once in 23 million, just to be clear on that.
No, we don't. We just have this one documentation in 23 million.
And we think a few more may start to come as researchers start to follow up. As we said earlier on as well, because it's a new outbreak, there hasn't been an opportunity. Opportunity is the wrong word because it's a positive word, but people haven't been sick, gotten well, and then been exposed again that much. And so that's why we're starting perhaps to see some of these cases. but we don't think
and
it's
it doesn't
happening
change what we're doing for the vaccine. So that's the other questions. People think, oh, this means a vaccine won't work. That's not what this means. I mean, we're still developing vaccines, and there's incredible progress being made on this. But again, the studies on the vaccine in terms of the response, the protection that a vaccine will provide will come from these clinical studies that are ongoing. So I just want to put it into context that yes, it's possible that we could start to see reinfection, but we have the tools in place that can prevent people from getting infected. And I think if anything, I want people to really understand that they have power in themselves, to be able to prevent infection from them, for them getting infected, and they also have the power and responsibility to prevent that passing to somebody else. And I think we have tools in place now that we just need to hammer in, because this is a positive. This is a virus that can be controlled, and it takes a lot of work, and it takes all of us to be part of it, but everybody has a role to play, no matter what age you are.